Hello everyone, I am Dr. Deepthi and I will be discussing in short today a visual question that came in the IMSS exam November 2019, right? So it was a visual question where this device is shown. So yes, this is a wooden Ayers spatula and it is used for taking pap smears, right? And it is the bifid end of the Ayers spatula that we use to take the pap smear, right? And the pap smear is taken, as we all know, from the transformation zone or the squamocolumnar junction, where the possibility of pre-invasive and invasive lesions is highest. And the ideal time or the best time to take the pap smear is in the middle of the menstrual cycle, right? And although there are no contraindications to take a pap smear, it can be taken any time throughout the menstrual cycle. But typically, the timing when the woman is menstruating should be avoided, right? And we would be taking samples from the ectocervix as well as the endocervix. So the Ayers spatula is going to collect the sample from the ectocervix of the transformation zone. And we will first sample the ectocervix, followed by the sampling of the endocervix. This is because, if we do vice versa, there will be bleeding which could interfere with the reporting, right? So we would first take the Ayers spatula, as I said, to take samples or secretions from the ectocervix, and then we will use the endocervical brush. So that's the endocervical brush, which is used to collect sample from the endocervix, right? Now we will see a short video on how we exactly take the pap smear samples in the OPD, right? So this is when you see here is a Cusco's speculum, which is the self-retaining speculum which has been put in the vagina. So now we are bringing the Ayers spatula, as you can see. So the bigger limb of the bifid end is kept at the external os and it is rotated 360 degrees. This is the endocervical brush which is put into the endocervix, right? And as you can see, the spatula is smeared onto the glass slide, whereas the if you can see, the endocervical brush is rolled onto the same slide, right? So the spatula is smeared and the brush is rolled onto the same slide, right? And I would go back a little again onto the video to show you that when you put the endocervical brush, right? So look at this. So when you put the endocervical brush, the bristles which are close to the stem have to remain at the level of the external os, right? So then you collect the sample and you roll on the brush onto the same glass slide. And very, very importantly, the glass slide on which you've made the smear should not be air dried. So there should be no air drying and the slide has to directly go onto the fixative. Now the fixative used could be only 95% ethyl alcohol or, as described, 95% ethyl alcohol plus 5% ether, right? So you put it into the fixative for 15 minutes and then it will be sent for cytology. Also, since these are all potential questions for other exams as well, I want you to look at another instrument, which is this. This is a cytology broom. As said, it is again used to take the cytology specimens, but this is typically used when we are using liquid-based cytology. So, both Ayers spatula and cytology broom are used for cytology, but with this spatula, we take conventional smears, pap smears. So we were making a smear from it. Whereas the cytology broom is, as I said, used for liquid-based cytology, right? So remember that this is another specimen that can be used for screening of cervical cancer. It is a cytology broom. It is also for cytology, but it's for liquid-based cytologies. And it is as effective as a conventional pap smear. The only advantage of liquid-based cytology is that it can also be done when the woman is menstruating. So as I said previously, that if she is menstruating, we should avoid making the pap smear. But if we are using a liquid-based cytology, the cytology broom, it can be used even during menstruation. That's one advantage. And the second advantage of liquid-based cytology over conventional pap smear is that the same cytology specimen that you've collected can also be used for HPV testing. Whereas in conventional pap smears, you have to use a separate sample which will go for HPV testing, right? So I hope you understand the concept of co-test, which is when you use pap smear along with HPV test. So, you'll have to use two different samples, one which is a smear for cytology, another one which is going to go for HPV. But with liquid-based cytology, I said the second advantage is that the same sample can be used for both cytology testing as well as HPV testing, right? So this is some of the important instruments that are used for cervical cancer screening, right? Which we said, that if you're using a conventional pap smear or pap smear for screening alone and the woman is less than 30 years, so if she's between 21 to 30 years, you will screen her every 3 years. Whereas beyond or equal to 30 years, if you're using again only pap smear, then it is 3 yearly. But if you're doing a co-test, yes, which is PAPS plus HPV DNA testing, then the interval can be extended to 5 years, right? Thank you so much.